5, 4, 3, 2, and 1. All right, folks, welcome back to the Trauma Therapist Podcast. I am very excited to have back Dr. Harry Zeit. Harry, welcome.
Welcome. It's great to be here.
All right. So Dr. Zeit, you last joined me on episode 416, currently works full-time practicing trauma therapy and psychotherapy. He's certified in sensorimotor psychotherapy, completing the final level of training in 2013. Harry previously worked as an American board-certified emergency physician in Cambridge and Toronto, Ontario, between 1983 and 2005. He's an advocate, active in the Medical Psychotherapy Association of Canada, and held the position of education chairman of the OMA Section in primary mental health care GP psychotherapy between 2011 and 2016. Harry created the Caring for Self While Caring for Others series to meet what he perceived to be a growing need for the medical profession to face challenges around unremitting stress and burnout, and to differentiate these physiology-driven processes from a mental health model which favored treating burnout as anxiety and depression. All right, Harry, welcome back. It's been a while. Since
a lot's happened in between. Yeah.
And a lot's happened. But let me just say that, you just so inspired me with your presence and your passion initially, which is why I invited you on. And you're just someone that I really am inspired by continually by the work you're doing. And I just wanted to say that. And I just want to thank you for coming back here.
I'm touched by that. Thank you.
You're welcome. So how the hell have you been? I mean, we talked before COVID, and what's been going on? How has that impacted you? How has that influenced the work you're doing and so forth?
Well, we can start by just getting over COVID now. So that was a learning experience. I was lucky. You're kind of dragged and I was tired, but I'm feeling quite good now.
Good to hear.
So that was January. I think I changed. There's something in me that shifted as the lockdown began. Certain things were coming to an end, like the Caring for Self While Caring for Others series. And there were political and financial reasons, but it had really truly run its course. I had gone from very personal, very nervous system issues to more global issues, and new things started. So I got much more involved in a training program for doctors to learn psychotherapy. So that built. But I think also something changed in terms of saying I couldn't push the way I was pushing because there was more fear, more uncertainty, and we didn't know how long this would be. So something got quieter and more reflective in me. And I've accommodated, and the work has been different, but it's been about the same amount of work, just opened up in different areas. So I can talk a bit more about what I've been doing today.
Yeah, please. You said you moved from more nervous system kind of attention to more global issues. What do you mean by that specifically?
Well, that was in the Caring for Self series itself, which ended in 2019 in the spring. And by the end, I was starting to, because I'd done so many talks, I think I'd done close to 35 talks.
Wow.
And I'm probably running out of how many little things you could do to lower your arousal or increase your arousal or do a Qigong technique or a sensorimotor technique. So we'd covered a lot of ground. And I was just naturally, in the last year, I just started to think about things that were on the horizon, like Black Lives Matter and activism and more planetary phenomenon. And I think once I reached that point, I lost interest in going back and doing it again in that series, but I'm coming back to it in different places. So,
but help us connect the dots between, look, you spent a long time as an emergency physician, got into psychotherapy and somatics, and now this interest and passion about the global issues.
Yes. Well, I think when I'm laughing, one of the curses or blessings is when caring for self. There were internal politics in medicine. As things got tougher, things tended and still tend to balkanize. And, it's a trauma response in itself. But one, a colleague of mine I very much respect, who's a guy who's done the world. He's older than me. He's now retired. He'd, been in the Vietnam War as a doctor. And he said, you know what? Go on Twitter and, I'll help sort of push your series. And that kind of introduced me to where the world hangs out with its trauma. So, I've been doing the gamut really, and I'm still doing workshops for clinics or for groups that ask, and we're doing some very foundational sensorimotor and nervous system work.
Mhm.
But I'm also, it's hard to ignore what's happening in the world, whether I'm on social media or, even my patients, my individual patients, one of them, ex-first responder, he is so passionate. He's in our capital now with the rally that's getting so much good and bad press. And other people are at the opposite spectrum and seeing that rally as a Confederate Nazi kind of hatred expressing itself, and people in the middle. So having to hold a lot of space, I think it's allowed me and invited me to step back and seeing how we're in a world right now where people can't hold everything, that it's too much. And so the trauma response has come up. Who do I blame? What do I do? What, how, and, it's almost that the group that needs treatment now might be a global group. Treatment's a bad word, but, some sort of reimagined way of healing and addressing what's hard to bear and hold.
How do you see your role in that, in addressing and working towards this reimagined way of healing in the global, because you're right, and I really agree with you, and I feel it, the world, we're going through this traumatic experience globally, and we can't ignore it.
Mm-hmm.
But what do you see, Harry, as your role in this? Because obviously you have a passion about this.
Yes, and I think it's become more tempered and in a way more trusting, because it really felt even when I first spoke to you, but certainly when I started, I am pushing, I am here, and I am preaching the trauma world. I am preaching, you got to get on board. And a lot of time it was for people who weren't ready and would push back. But looking back, if I look when we first talked, I was already learning that I had not had, my personal moment of glory in the sense. But I looked around me and I looked at how many doctors, say, were suddenly coming up and talking about trauma, talking about social determinants of health. And then COVID came and more doctors were coming out and saying, I looked at who's in my ICU or who's in my ER, and this is not a cross-section of Canada. This is people that are oppressed or less fortunate or economically or racially, somehow experiencing adversity. And that adversity, just like childhood adversity, tends to lead to adult PTSD, and all that adversity was leading to illness and that. So the world I occupied starting 2 or 3 years ago was a different, more receptive world. And I realized that it didn't have to be such a fight, that there's actually a lot of people that are awakening now, and a lot that are fighting back. So there's this tension in medicine. And I think just by chance, I moved into this one-year training program we created. And it happened just around the time I was speaking to you. We were working on it, and it was a funny thing because someone else wanted to do a training program, but they kind of wanted to do it on their own, and and they were kind of pushing me and people in the MD Psychotherapy Association, kind of, can you just support my program? And we said, hold on, like if we're going to do the program, it's a really cool idea, but we want to do it in a way that's broad-based, that's experiential, that's not just one guy with a few add-ons
Mm-hmm.
talking about kind of psychiatry light, that we want to bring in more vision. And, it's here in this place that I realize that, now it's done really well. I'm amazed. So we did 30 people in person, and then the program almost died because then we didn't get people. Canada's a big country. It was hard to get everybody to come 5 times to a retreat
And this was
center.
for physicians?
Yeah,
Okay.
and nurse practitioners. So since the pandemic, we finished 2 groups of 30 physicians and have 2 more began. So we are reaching, by the time this is over, this iteration or this group will have taught 150 doctors.
And taught them what, Harry?
So in some of what we teach is basic. So if we could divide it into 5 modules, they're intensive modules and they have supervision in between. The first one, they learn attachment, interpersonal neurobiology. So some of the principles, and they get a little bit like the first session and how to chart. And then the second session, which I just did with my partner, I do the second and the fifth. We do the therapeutic alliance, really focusing on the importance of the connection, of holding space,
Mm-hmm.
of repairing ruptures, of noticing shame in the room. Then they move on and they get their psychiatry, they get their drugs, and they get their charting and assessing for suicidality. Because it was important that we, in my mind, that I wanted people to say, no, we're not, just giving you an alternative map of the universe. We're taking the map you have and we're giving you new maps and new ways of being without. So I'd learned from earlier work, it's much better to be collaborative and to accept what people bring. So then we move, the fourth module is transference, countertransference. And the final one, which I do, is all trauma with a little bit of self-care in it based on trauma model. So, when I first started talking to physicians about trauma and, saying how much of what they see is complex trauma, and that doesn't matter if you're seeing autoimmune diseases, you're seeing complex mental health, they're all, no, no, that we don't want to go there. People were getting charged, they were getting activated. Now people are pretty accepting of it and much more open to it. So, I think being part of that, of a larger dialogue, even if it's a minority of people in medicine, that minority still ripples out
Mm-hmm.
and impacts people. So,
do you think that shift in awareness, in a sense, in a willingness to accept, in a sense, the trauma is due to what the pandemic is due? What do you see it as a result of?
I think there are many factors. I think the people going into medicine now are different people, and they come from different backgrounds. I think they're also questioning, because when I started medicine, it was fun, for the most part. It was hard, but everybody felt they were doing well. They were making an easy life for themselves. And now, it's healthcare all across the board is very challenging. It was even before COVID, and it's becoming more challenging now. So we have more people from many different backgrounds. And I I think somehow it's in the world. I see the good and bad of it, but
Hmm.
people are becoming politicized, and doctors are no exceptions to that. So, they're more open-minded of some things and closed-minded of other things. But also in Canada, I think we've had a bit of an easy journey. We're rather affluent, protected country, and that's changed because we've had so many ways of immigration, and more doctors are exposed to working with people with adversity, with refugee populations.
Hmm.
So, it wasn't, 10 years ago, someone wouldn't say, yeah, I thought that until I talked to my Chilean patients or I talked to my Syrian patients or so forth.
Do you feel that the pandemic and the anxiety, certainly that it's caused a lot of us, and uh, trauma in a sense, do you feel that shifted the way you personally interact with your clients or your patients, and what you teach others?
Yes. And I think, well, for starts online, it's much harder to do sensorimotor psychotherapy. Some people would disagree, but and also people aren't looking for it so much. I've taught and I've practiced holding space, being a witness, sort of coming very open, and being present to whatever shows up, and a very compassionate, expansive way
And
to
has that
receive.
shifted from before the pandemic, do you think, for you?
Yes, I do think
Why?
so.
Why is that shifted? How so?
I think because, part of it was natural and some of it was what I was reading, and what people were bringing. And, it suddenly we weren't just processing old trauma, we were living in current trauma,
Hmm.
and people were very afraid, and the needs changed. I can say I've done 3 different groups for doctors. This is plus this, so this is outside patients, but it kind of the same thing, whether it's patients or doctors, and same needs, same, we all bleed the same. And the, the first group was more like early on, and we were reviewing cases and supporting one another. And then I did a group for an ER, and all these invited me outside the official channels because there's some cynicism about how the official channels of wellness are working. Same in the States, and that one kind of nice. I just teach, a tool or two, and then I just let them interact, and it worked. Just holding
Hmm.
space, and in their own wisdom, their own answers came, and they were great. They were a tight ER group, and they wanted me because I'd been an ER doctor, and they felt heard, and that I knew what they were talking about. The last group, which I just finished, I don't think it went so well. We were invited to do a very standardized 9-week sensory motor skills group, teach all the nervous system, all tools. And I realized that would have been fine 3 years ago, but the people had just needed connection. They needed time to talk. They needed to be heard. And that need to be heard and seen, I think, is very big now.
Hmm.
I think people feel drowned out. They have trouble even hearing their own voice in their inner world, because so much now is against interiority. You know, I think the Ken Wilber old integral model. You had the 4 quadrants, and you had the interior, like the consciousness, and then you had science, and you had culture, and you had systems.
Hmm.
And I'm kind of a systems guy, so I get mad at I hear people sometimes, but um, people like are losing that connection just to themselves, and I think when we hold space really well, my hands are like off the screen, that it gives people a chance to reconnect.
When you say hold space really well, what are you talking about specifically?
Yeah, these are hard things because, again, even teaching, like what does attunement mean? What does presence mean?
Hmm.
I remember reading the book that Bruce Perry did together with Oprah, What
Mm-hmm.
Happened to You?
Mm-hmm.
And Bruce keeps saying, present, attuned, responsive, attentive. You know, if you are with someone that has those four qualities, you'll get better, and if you're not, you won't. I, it is a, to me, and I know you think about this a lot, and I'm sure you practice this as well as anybody. So being in ourselves, but being present to another. But in some ways, it's that awareness, I think, of what the analyst called the third, that we are working in the moral universe where it's you and I, and there's a sense of right or wrong, and of being witnessed by something larger. And which will bring me to the other point. You know, moral injury has become such a big issue in medicine, and I think in patients as well. People are really feeling let down and betrayed. And so to have presence with the quality of, you know, I am here for you, I am listening, you have my attention.
Mm-hmm.
And also feeling that I'm relaxed, that I'm not in my head thinking of the next thing to say.
Right.
You know, I have a, you know, I don't work without a plan. You know, I can reflect on where therapy is going, but in the moment to be there.
It's very interesting, Harry, to hear you talk, because on one hand, you know, you're bringing up these global issues, and on the other, these very kind of, you know, the importance of being present individually and with another person.
Yeah. I just wonder how we could expand that to be present with one another in that way, because the world so needs that.
You go ahead.
Yeah. I'm thinking, you know, a lot of people are talking about the movie Don't Look Up,
Mm-hmm.
you know, because it's such a metaphor for what we can't look at. And, you know, they end with that little meal where people are really witnessing and being with one another. But, you know, how could that be on a more global scale?
Yeah, I think it's very interesting, this idea of, in one hand, it sounds so simple, right? To
Yeah.
be with someone, to be present with someone. And I appreciate how you said, well, what do those things mean? What does that mean to be present? And those are the questions I ask, because I think a lot of times we throw these words out, these concepts out, presence and authenticity and so
Yeah.
forth.
Yeah.
But what does that mean? And especially now in this era, in this time, people are going nuts. We're
Yeah.
all ramped up and amped up. And I think you're right. People aren't, they don't feel like they're being heard. And it's such a valuable, I think, attention that you're bringing to this.
Yeah. 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 And people so want to be heard and need to be heard and seen, you know, feeling felt. You know, we had an interesting discussion in the module on therapeutic presence, because everyone was talking mindfulness. You know, I'm very mindful when I'm with my patients. And I make sure they're mindful. And then actually, I talked a little bit about with Pat Ogden, you know, who's the founder of sensorimotor psychotherapy, when I was starting to do a little bit of work with first responders and asking her. But it came up in that discussion, and she said, you know, people don't want a mindful therapist, they want a present therapist. It says, I'm mindful about 10% of the time, I'm present about 90% of the time. Meaning, you know, presence is the flow. I'm flowing with you. We're moving together in that magical right brain to right brain way. Somehow we're doing a dance that's as ancient as life itself.
Mm-hmm.
With mindfulness, you know, I sit back and what am I doing here? Am I on my model? Is this working? You know, do I need to do something else? And then we go back to that present. But that's very hard. I think, especially for new people that were even thinking about doing therapy, they're, oh my God, what are these people talking about? How am I ever going to do this? But, you know, we model it for one another. And I think I learned presence watching people that were very present and feeling what they were doing.
What are some of the things that make it challenging for you personally to be present, or to be as present as you want to be, or need to be, or feel you should be?
Yeah, when I'm tired, or I'm triggered, or I'm working, doing that extra session, and those would be, my life is impacted by what's happening on the outside. And sometimes I say the best I can do is to be conscious of it, to not walk around with that inflated belief that I'm always present, but to accept my humanity, and that I get pulled in and out. And that's where the rupture repair thing, I think, is so important. Whether you're a parent or a therapist or a friend, that we're not always so present. But if we catch that look in the other person that says something, it turns us around and turns that around for them, because they're like, wow, you saw that.
Mm-hmm. Yeah. You said one of your hopes is that, or questions is, how can we make this increase in presence, or the attention to presence, make this more global, right? What are your thoughts on that? How do you see that happening, or how are you working towards that?
I think, whether it's consolation or truth, or that, I believe in the ripple effect. And mass movements that say we can force people to do that. So I really value every gesture. And I know so many of the guests you bring on, are doing their little bit to just champion that kind of kindness. We on the weekend, a few of the people were very close to Thich Nhat Hanh, and we kind of brought him in and read one of his poems, where I am both the boat person and the pirate that rapes the people on the boat. Call my true names. And I think there are spiritual people that bring more presence, and therapists that do that, doctors, podcast presenters, but just to maybe be aware of that network. And I don't know if there's a way for all the people with a vision to somehow organize or connect. But I think it's an important thing, and I think people are writing about it. They're writing about, while we have this group that's kind of fanatical, and we have this other group that's given up and they're nihilists, but we really want to create this middle group that's about reimagining and regenerating and building kindness. And so, I get my chances if I get to do a talk at a conference, or I get to speak to a group. I feel I'm cultivating the things, but, and other people will write books and will do other things.
As we kind of close out here,
yeah,
we have a lot of listeners who are obviously therapists and coaches and survivors and therapists themselves. What would you say to them if they want to pursue this, if they want to cultivate more of what you're talking about?
I think it's the first and foremost, and it's with everybody that cares about the world, it's finding ways to build community. There are so many of us, and we just lack that collective voice. So to me, to find your tribe and to see what you can do as your tribe, as a member of, say, ISSTD, that ISSTD can do things that I couldn't possibly do. So something I want to support. And again, as we created that, even the Doctor Therapist National Association, it was again creating a voice. So, I want people to know they're not alone, and I want them to know it can be very hard at the beginning. Some people luck out, they find their tribe right away. Other people might wait years or decades, but the people are there, and to keep looking and keep staying connected to yourself. Don't lose yourself. And sooner or later, you're going to resonate with someone else and say, wow. And then the two of you will resonate with two more.
Mm-hmm.
I think that's what the world needs.
Awesome.
Mm-hmm.
Harry, what's the best way for people to get in contact with you?
I think you've linked my website, which I haven't been paying much attention to. I'm so busy. I'm trying to avoid, but I love contacting people, and it's been great talking to people from England and US and all kinds of different avenues in the last couple of years. So my email, drharrysite@gmail.com, is a great way to reach me.
Okay.
Yeah.
On this podcast, I hope that I can bring people like you on. I mean, for me, you just symbolize in a glowing way what I think is really important, what I want to get out there. And I am so friggin' glad that you come on this podcast, Harry. I love it.
Well, thank you for, it's not always easy to get a voice and be heard in the world. And, medicine, you fight tooth and nail because everyone wants to be seen or heard. We're all like looking for our moment. So I appreciate, and this is the kind of venue that I want to be on, that I really, the work you're doing is rippling out. I know that. So
I appreciate it.
Wish you all the best.
Thank you, sir. And I'm glad to hear you're recovering.
Yes.
Awesome. All right, Harry, you have the key to my podcast. Whenever you want to come back, you're welcome.
Oh, thank you.
All right, sir. Take care.
Bye-bye.
Bye-bye.